this august audience and the organizers. Today my topic is the investigations. Before starting investigations, let us go quickly on clinicals. Without any clinicals, we cannot jump over the investigations. Investigation of erectile dysfunction and their legal validity prior to medical, psychological, and surgical management. Sexual medicine and clinical methods. Next. Like any other branch of medicine, sexual medicine also follows the principles of modern medicine, like inspection, palpation. Of course, percussion and auscultation are not there. During inspection, we have to observe the absence of secondary sexual characters, gynecomastia. Next slide. There could be congenital malformations, hypospadiasis, phimosis, or paraphimosis. In this particular slide, can you show? Okay. During childhood, bilateral hernial surgery was there, and somebody removed both the testicles. This patient came to me at the age of 26 with an infantile penis. After giving 2 doses of testosterone, his penis grew up normally. The position of the flaccid penis, photos of this penis during a rigid phase to be taken by the patient himself. We educate the patient to take certain photos while it is erected. So there are certain basic questions. What is the normal length of the penis? What is the minimum length required for the successful intercourse? What is the minimal duration of IVL period? Intravaginal latent period. Next. In the rigid penis positions, if it is looking downwards like this, the glance is looking towards the ground, the chances of intercourse are almost nil. If the penis is at 90 degrees, may or may not enter into the vaginal introitus. But if it is at the obtuse angle, looking towards the umbilicus, there is a maximum possibility of the successful intercourse. Next slide. How to measure the penis? If it is measured from the penoscrotal junction to the glans, we may get erroneous record. To avoid that, one should measure from the pubis. One should take a transparent scale. One end of the penis scale should touch the pubis. Penis must be pulled, or a flaccid penis is stretched and measured. Next. During palpation, you can see the slides. 2 fingers down and 1 thumb is up. If it is pressed, there should not be any softness. If it is rigid, we cannot press the thumb down. Only rigid penis can enter into vaginal introitus. Of course, we can see cardio also in this patient. Another slide. During investigations, penile Doppler study during flaccid as well as rigid status. During rigid status, peak systolic velocity must be more than 30 ml per second, whereas the diastolic velocity should be less than 3 ml per second. It is easy to understand that more blood will be coming and less blood will be leaving the penis. There is percussion and auscultations are not applicable. How to evaluate the nocturnal penile tumescence? There are normal parameters. Duration must be more than 30 minutes and at least 5 episodes per the night. There is an increase in the circumference more than 3 centimeters at the base and more than 2 centimeters at the tip of the penis. Next slide. There are other investigations like during this penile Doppler study, it is not 100%. It don't tell us that patient can have the successful sex. We can only see the velocity. Even if the normal penile Doppler study, one may not have the intercourse. Then we discuss about a Rigi scan. Rigi scan is based upon the NPT, nocturnal penile tumescence. This has got also limitations. People think that a Rigi scan will tell everything. Actually, Rigi scan fail to discriminate beyond 450 to 900 grams. What is the rigidity? Rigidity is defined as the state of quality of being stiff or inflexible, and it is the force. The axial rigidity is measured in the grams as a buckling force applied to the root of the penis. This is rigidity scale designed by myself. Each side is about 250 grams, and the red ribbon is applied at the base of the penis. Next slide, please. Axial rigidity should be more than 550 grams is necessary for vaginal penetration from Campbell Urology, page number so and so, and volume 2. Next slide, please. This radioisotopic uptake more than 20 ml per minute per 100 milligrams of tissue. All these are theoretical, not practically very much used. Most of the radiologists are also not aware to interpret it. Even MRI is also not a definitive diagnosis. This sequential contrast of the MRI increasing in the corpora cavernosa must be observed. But I tried several times with my radiology colleagues. They could not tell. The arteriography, it is quite invasive technique. Most of the patients do not accept it, at least in our Hyderabad scenario. Then I tried X-ray cavernosography. In the cavernosography, we inject the dye into the corpus cavernosum and try to see whether any leak is there. So that is a cheaper diagnostic methodology. Simple X-ray is taken after injecting the dye and try to see whether the dye is leaking anywhere in the crural veins. Next slide, please. Cyst test. Almost every day we do this test. It is a combined injection and a stimulation test. The drugs used are papaverine, largactil, or phentolamine, alprostadil. Alprostadil is sold as alpostin. It is PGE1, prostaglandin E1. This is a very common drug-induced priapism during this cyst test. How to manage this? Because of this priapism, most of the radiologists do not take up this investigation. So we have to exsanguinate by the scalp vein set, insert it into the corpora cavernosa if priapism occurs because of these drugs. Adrenaline should not be directly given to the corpora cavernosa. It must be diluted in the NS and given small amounts of NS as a wash. If it doesn't subside, then we have to go for surgical management. This biopsy of the cavernosal tissue, we can take it only during the surgery. Most of the patients are not ready to do prior to surgery for this test because it's neither the cancer nor any life-threatening disease, erectile dysfunction. So most of the times we take up this cavernosal tissue while implanting the penile implant. Next slide. What are the legal implications? For a rape, no investigation is defensive for rape. Even if somebody puts a finger, that is equal to rape with the changed scenario of legal. seen in India. Then in diverse cases, most of the times people approach us. We do take penile Doppler study, clinical evaluation, hormonal evaluation, semen test. All these things are of some help to us. Then medical legal cases faced by the doctors. So we have to have the circumstantial evidence regarding the patient visits, explanation given to the patient and his attendants, clinical evaluation, the hormonal evaluation, and penile Doppler study are of great help. Next. Thank you. You can have any questions because sexual medicine is also a branch of medicine based upon the evidence and whatever the science we elicit must be elicited somewhere else also. So it can be repeatable. So I'll be happy to share my experience with the August audience.